in speaking to my Amendment 297D, I'd like to thank the noble Baroness Lady Masham and Lady Brinton for their support, but also just to express my general support to Baroness Greengross, Lord Howarth and Baroness Hodgson for their amendments, and the importance of the collection of amendments, which I think the common theme is how we support vulnerable people. My own, my lords, is really about the experience of many of us who've seen the harm caused to our loved ones in care homes during COVID, when for so long visits were not allowed. And even now, my lords, it can be difficult in some homes to visit because of the COVID restrictions that continue, or where there is a member of staff or a visitor has COVID, and then days long, 14 days long, whatever, impositions are put. And so, my lords, it is a bit rich when one hears in the media that all restrictions have been lifted, because the practice, my lords, is for many of us, those restrictions have not been lifted at all. And the Joint Committee on Human Rights, in their report on care home blanket bans and other excessive restrictions, my lords, recommended that regulations for care and treatment should include a requirement to ensure face-to-face contact wherever possible between residents and the people most significant to them. My lords, I don't underestimate the difficulties faced by care homes in the last 2 years. They've had huge challenges. My own personal experience is that many of them have risen to the challenge and provide high-quality care. But, my lords, even before the pandemic, serious concerns were growing about the use of care home visitor bans to punish relatives for complaining about standards of care. Indeed, as far back as 2016, the Victoria Derbyshire programme reported hundreds of care homes were guilty of this method of what they described as institutional abuse. And in 2019, the Relatives and Residents Association were coming across at least one case a week and warned the problem was increasing. One woman found her mother dressed in other people's clothes, left in her own urine, and with her hair unwashed for weeks. And the local government and social care ombudsman upheld the daughter's complaint, reporting that after raising her concerns with the care home, she and a doctor were prevented from seeing her mother when they tried to visit. The care home later told the ombudsman the ban was because a previous incident reported to the police because of the daughter and her partner's behaviour. But, my lords, it could not provide any evidence that an incident had occurred or was indeed reported to the police. Now, my lords, as these visiting restrictions hopefully are going to be relaxed in the weeks ahead, we, I'm afraid, have the prospect of seeing more residents' families being victimised in this way. Helen Wildbourne, Director of the Relatives and Residents Association, has found from their helpline calls that relatives and friends play, of course, a vital role in spotting potential human rights violations, particularly around abuse and neglect. And when they're locked out by bans, people in care lose crucial support. That's their advocate, their confidant, and they might be the only person that tell about their concerns. Sometimes residents, my lords, are even threatened with eviction or actually evicted in reprisal for complaints about their care. Now, the Human Rights Joint Committee was told about a family whose mother was threatened with eviction after they merely asked to discuss concerns with the head office of a care home. So these are the kind of abuses my amendment seeks to tackle and get over the problem that regulations are not sufficient. My lords, these regulations may specify that standards of care against which care providers are regulated by the CQC through their inspection process, but the CQC are not going to pick up individual complaints. And so, my lords, there is a gap. I think there's a strong case for a statutory duty of care sitting alongside CQC regulations to require care providers to facilitate contact with families as is reasonably practical, and to prohibit evictions where non-vexatious and non-repetitive complaints are in progress. Now, my lords, my amendment, I'm not obviously proposing that today. All I'm asking for is a review, an independent review charged with examining these options. My Lords, I do hope on this the Government would agree that there needs to be some reflection on what has happened and how we can prevent this kind of abuse in the future.
Amendment 297D, we fully agree that visits from loved ones are of vital importance to care home residents' health and well-being. DHSC guidance emphasises that visits to care homes should be facilitated based on individualised risk assessments. Care home residents should also be supported to nominate an essential caregiver who may visit in most circumstances, including if the care home has been closed to visiting for any reason. My Lords, there is an existing process in place if a resident or their family are concerned that guidance is not being followed. We would encourage anyone with concerns to raise them. This can be done both with the care home, who have a legal obligation to operate a complaints procedure, and with the CQC. The CQC will follow up on concerns and take regulatory action if needed. It has provided mechanisms for people to feedback on concerns of care. The CQC respond to all concerns passed to them and can receive concerns anonymously via representative groups such as Rights for Residents. Where those concerns have named the provider or service in question, the CQC has followed up the cases. 54 concerns regarding care home visiting arrangements have been raised during the pandemic. CQC gained reassurance in all cases that visiting is now in line with guidance. In 12 cases, the CQC secured this assurance by inspecting the service. My Lords, my department has not seen any data or reports of eviction of residents following complaints against care homes. If a care home was taking such action, it would be in breach of guidance. A complaint should not lead to a resident being asked to move to a different home, or the terms of eviction, or the terms of evictions and processes. And the terms of evictions and processes followed should comply with consumer law as per the CMA's guidance. People should feel confident that complaining will not cause problems for them. My Lords, I do recognise that this has been a difficult time for care home residents. However, existing powers in legislation are robust and do give protection to those who need it. And we therefore do not feel at this time an independent review is necessary.